Trying to book a COVID shot and hitting a wall? You're not alone. New federal rules plus state-by-state differences equal sign a messy patchwork this fall. Today, I'll tell you who's eligible, where you can actually get vaccinated, what paperwork you may need, and how to navigate the new roadblocks step by step. Until this year, updated COVID shots were easy. Pharmacies, most ages, no drama. In late summer 2025, FDA narrowed access, full access for 65 plus, and for under 65 only if you have at least one risk factor for severe COVID. That shift triggered insurance and pharmacy policy changes, and a lot of confusion. If you're 65 or older, you're good. If you're under 65, you likely qualify if you have any condition that raises risk. Think cancer, chronic heart/lung/kidney disease, immune compromise. But also broader common factors like overweight or mood disorders that many Americans have. In some states, self-attestation at the pharmacy, checking a box on a form, is enough. Bottom line, even if you think you're ineligible, you might qualify. Don't rule yourself out. Here's the twist. In some states, pharmacists can't give COVID shots unless the CDC's advisory panel has active recommendations on the books, or unless you bring a doctor's prescription. With recommendations in flux, chains like CVS and Walgreens have started requiring prescriptions in 16 states, and stopped entirely in 3 due to state rules. That's why your local pharmacy may turn you away, even if you qualify under FDA rules. If you're 65 plus, you're eligible. If under 65, scan your medical history for any qualifying risk factor. Many are common. Search your state health department site and your pharmacy's site. If your state allows pharmacist vaccination without a CDC panel vote, you may book directly. If your state requires more, plan for a prescription or use a doctor's office or clinic instead. Most places use self-attestation forms. If your pharmacy wants a prescription, message your primary care provider's portal and request one for a COVID-19 2025-26 updated vaccine, mRNA, Pfizer, Moderna, and Novavax protein-based. Some states also require an mRNA waiver disclosure. If you want to avoid that, ask for Novavax. Insurance should still cover people who meet FDA criteria. For off-label scenarios, like healthy under 65 without listed risk, coverage is less clear and may vary. If you're uninsured or denied, check your local health department clinics. Many offer free or low-cost shots. Two groups with the most confusion right now: pregnant people and healthy kids. Medical societies still recommend vaccination for pregnancy and early childhood risk, but access may depend on state rules and whether your clinician provides the shot off-label. Practical tip: call your OB/GYN or pediatrician first. They can vaccinate directly, even when pharmacies can't. The CDC's vaccine panel, ACIP, is slated to meet September 18, 19. Their decisions can unlock pharmacy access in states that tie authority to ACIP recommendations. Expect shifting rules. Some states are already issuing stopgap orders to keep pharmacy vaccinations going. Recap: 65 plus, you're eligible. Under 65, many qualify. Check for any risk factor. Pharmacy blocked? Get a prescription or go to a doctor clinic. Coverage: generally yes if you meet FDA criteria. Clinics may help if not. This is changing fast. Bookmark your state health site and your pharmacy's page for updates. If this helped, like the video, subscribe, and share it with someone trying to book their shot.